Function with Purpose podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 4, Episode 3 of the Function with Purpose podcast. Dr. Amy here with you on this lovely morning, afternoon, evening, into the early morning, wherever you are in the world. Welcome. Okay, we're going to get right into it. So maybe there are plenty of you out there who have been to many different types, quotes, of physical therapy clinics or niches. Those kind of have a purpose, right? So when we go to physical therapy school, we learn general aspects of what it is to be a physical therapist. So we learn things all the way from people who are recovering in the acute care setting, meaning perhaps they just had surgery and then they're in the recovery room within the hospital, and the physical therapist comes in and does an assessment on them at the bedside and maybe a little bit of walking. And maybe after that patient finishes up acute care physical therapy, they might go on to rehabilitation, where that type of physical therapy niche is more intensive. So those individuals receive about 3 hours of therapy, which do include physical therapy, speech, and occupational therapy. So physical therapy overall, yes, is a profession, but there are different types of niches out there. So that serve the different types of population. So for example, you have your sports physio. Okay, everybody is a sports physio. It is so oversaturated with sports physical therapists. But some of these sports physical therapists, maybe they specifically work with elite athletes, or maybe NBA athletes or WNBA athletes, all the way to maybe the elite CrossFit athlete. Maybe another physical therapy niche specializes in the older adult or the geriatric population. So geriatric, kind of think of those individuals who are in their 70s, 80s, 90s range, or even 100s, right? And then there might be physical therapy niche clinics that specialize, or their main focus is in pediatrics. So know that there are these different types of physical therapy clinics who kind of gravitate towards a specific population. So not for physical therapy clinic is the same, right? As I mentioned, you kind of, for example, Fortress, who is, or what is the type of individual that Fortress gravitates towards, and who do we help treat and assess and keep in the game? So Fortress, we focus on maintaining health and fitness by preventing future or frequent recurrence of injury, which then promotes you to be sidelined from participating in exercise or class workouts or even life pursuits, right? Your daily routine, or maybe you're training for a half marathon. The goal with Fortress, our main focus, is learning how to train around pain or perhaps injury without being sidelined from the things that you love to enjoy in life. Or maybe the main thing that you love to enjoy is participating in the CrossFit daily workout every day. So keeping your health first and digging deeper into your health and fitness profiles in order to maybe expose some, what I like to say, quote, cracks in your foundation, which then we help bridge that gap in those cracks, i.e., still going to class and still participating in exercise or still participating in that long hike that you like to do on weekends, but knowing proper dosing, as well as your response to activity, right? So really digging deeper into your health and fitness profile, because that's where it's at, right? Fortress focuses on maintaining your health and fitness profiles by preventing being sidelined from life pursuits, as well as learning and digging deeper behind the why you're getting the shoulder pain, doing a gut check, etc. So Fortress works with completely independent people, meaning independent people who are able to fulfill their societal role, right? But along the way, they kind of just get some aches and pains, and maybe they want to pursue getting into weightlifting or going into a Spartan race. So that's where me, through Fortress, we kind of dig in a little bit deeper. So that really gives you a nice, hopefully, intel or insight on kind of what Fortress does, what I do with my patients, as opposed to some other physical therapy clinics that perhaps maybe your physician just sends you to, right? Oh, your knee hurts. Well, go to such and such hospital outpatient physical therapy clinic, because you'll most likely see that specific therapist or assistant 3 times a week for 4 weeks, and then you follow back up with your physician. That is such a broken healthcare system. That is not healthcare, right? So it's a whole nother subject to go down. I'm not going to go down that rabbit hole, but know that there are different physical therapy niches. Also, another niche that might be out there, and that is out there, I personally know them, is physical therapists who specialize in seeing patients post cancer surviving. So we know cancer, any type of cancer, right, affects the body as a whole. Even if it's benign cancer, where the tumor perhaps is contained, to perhaps a malignant cancer, right? So I know there's a local physical therapy clinic around here in Charlotte that specializes in cancer survivors. So, you kind of have to do, yes, a little bit of Googling, but using specific words, right? So know that these different types of physical therapy niches are out there. And if you feel that you are an individual who may fit well with Fortress, I would definitely love to help you out. If you need some guidance on, oh my gosh, like, I just had surgery, should I go down this route or that route? Who should I see? You know, verbal referring, right? Hey, I went to Fortress and they did a pretty good job for my plantar fasciitis. It sounds like you might be experiencing the same thing. I think, go check out Dr. Amy, or go check out Dr. So-and-so from their named clinic. So it's all about finding and knowing about these different niches, and that there is a difference in these multiple physical therapy outpatient clinics. All right, so Fortress, we are an outpatient physical therapy clinic, non-affiliated with insurance is, because this is health care. This isn't sickness care. We are caring for your health, your musculoskeletal health, and understanding basic metrics to your health profile, which then carries over to your fitness profile. So, just a little tidbit on the types of physical therapy niches that can be out there. And do your own research and maybe ask around to some other fellow friends or family members and perhaps see if, word of mouth. Like, I love getting word of mouth referrals. Like, it is the best. That's where it's at. So, yeah, if you're in the Charlotte, North Carolina area, definitely reach out to Fortress, Dr. Amy, me. And if I can help you, I would love to work with you. If not, I can probably most likely find someone who can within your area. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.